I'm Dr. Gulani. I'll explain to you today what presbyopia means. Presbyopia is actually a term that means aging vision. Let's make it a little more appealing, all right? Let's call it as we mature. The vision changes as we mature. So what happens in our eye in presbyopia is you see these muscles right here, like strands of a hammock that hold our natural crystalline lens and make it zoom in the eye, telly and wide. And that zooming decreases because the muscles itself go weak and the lens becomes stiffer. So now that your lens is not zooming in the eye, you'll see people zooming with their hands, right? They zoom and keep their books or newspaper or anything further away as age and time goes on. This affects most people after the age of 40, 45. Since I see patients from all over the world, that age range really varies, even with genetic and cultural differences I've seen. So presbyopia is basically a difference or a decrease in what we call the accommodation or the movement of the lens to make you read up close, and so you're stuck with very poor vision up close. Now, most presbyopic patients have associated nearsightedness, which is a minus number, or are farsighted, have a plus number. So what happens there? If you're nearsighted, you'll see these patients cheating. They take off their glasses and they can read right here because they're nearsighted, okay? So don't feel envious about them. They can't see distance. And there are people who are farsighted, and these are the most common patients because they never wore glasses until they were 40, 45. And then that plus which they needed for distance gets added to the plus that they need for reading, and suddenly they go, my God, I started needing glasses from yesterday. This is horrible. All right, so that's the typical presentation. Presbyopia requires you to wear magnifiers or plus-powered lenses, also called cheaters. And these are the glasses that you see people keeping all around their house, office, and cars, and to help them read. And the other important things that happen here is you need more light also to read, which is also an impact of what we call dysfunctional lens syndrome. The lens is still not completely cloudy like a cataract, but it's decreasing the amount of lights that are coming in. So to read, you not only need a plus-powered lens, which is glasses, contacts, whatever, and you also need more light. That's what happens as time goes on in aging. There are various ways to treat this. To me, it is very important that we treat these patients and holistically treat them. Don't just treat the presbyopia, treat the associated problems too, whether they're nearsighted, farsighted. So let's say you're in the 40s age range and you have presbyopia. Now, you can have a laser technique that I've worked on for the last 3 decades, all these laser lens techniques called LaZrPlastique, where without cutting, using any blades or chopping or causing any cuts in the cornea or flaps, I shape the cornea to make it read up close while keeping the distance vision. And I may do both eyes to create a blend concept of vision. Now, if you were used to monovision before for a long time with contact glasses, that can be simulated. I prefer the blend vision because it's the next level of vision with better fusion or stereopsis or 3D vision, right? So laser techniques can be used for presbyopia. Second, if you have associated issues like near or farsightedness, with the same laser, with a different algorithm, we can fix all of that at one shot. All of this is on top of your cornea with numbing drops and no pain, and you're done within minutes. Let's say your lens, let's say you're 60 years old now, and with presbyopia, your lens has become slightly cloudy at this point, right? An early cataract. We can remove this lens and replace it with an artificial lens that has what we call a multifocal optic. You know, when you wear contact lenses and glasses, the progressive glasses or the trifocals and bifocals. So we are privileged to be involved in some of the best technologies in the world, among the first always. And those kind of lenses can be put inside your eye permanently. So you can have a progressive, a multifocal, a bifocal, a trifocal lens in your eye in place of where your early cataract was. And that stays forever, and you can see distance near everything and be free of glasses, right? So if you're in your 60s, you can have that surgery to change your lens. In your early 40s and 50s, you can have laser techniques on the cornea. Another thing I super specialize is in combinations. Let's say someone did your cataract surgery and left you with reading glasses now. You can do LaZrPlastique to correct that reading and bring you back to excellence. Let's say you had LASIK in the past, or monovision LASIK or something, and now you have matured. Now, we can work on the lens in the eye and still make you see without glasses to read, right? Lots of combinations, right from techniques to technology to different kind of lenses that can be used too. So there are so many combinations to help people to get out of reading glasses and lead their life fruitfully. So my whole principle is not only to fix the reading, but to fix all the errors that you have and be free. So you have no limitations right from the time you become presbyopic to the end, whether you had previous radial keratotomy surgery, previous Lasik, previous cataract, previous PRK, any surgery that you had in your youth for glasses, you can now be corrected for reading. Absolutely keep that in mind. And if you've had any surgery that did not work, it can be corrected. Lasers, lenses, and combination techniques, and innumerable options of lens implants. Don't fall for just 3 options. There are more than 3. There are about 30 lens technologies approved in the US, close to 70 in the world. It's been my pleasure to be experienced with nearly all of them with my international privileges. So if you are presbyopic, if you are getting into those pesky reading glasses and life is becoming difficult, you can be corrected with LaZrPlastique, LensoPlastique techniques or combinations. So here we are in Jacksonville, Florida. Me and my amazing staff are always here to answer your questions. Delve into my website. There's a lot of information out there for you, and I look forward to seeing you. Dr. Gulani.